Bismillahirrahmanirrahim. So we will discuss every muscle one by one. First muscle is the pectoralis major muscle. In this video, our main focus will be on the origin and the insertion of the different muscles. So pectoralis major, it arises from the medial half of the clavicle, sternum, and upper six costal cartilages. In the diagram, you can easily say this is the large muscle. Its origin is clearly evident in this picture. Costal cartilages you are not seeing just because it's hidden beneath the muscle, and it's inserted into the lateral lip of the bicipital groove of the humerus. And in the picture, you can easily this is the bicipital groove of the humerus bone where it is inserted. So in the next muscle we will discuss pectoralis minor muscle. It arises from the third, fourth, fifth rib near their cartilages. In this picture, this is the pectoralis minor muscle. It is clearly seen that it arises from the third, fourth, and the fifth costal cartilages, and it is inserted into the anterior border of the coracoid process of the scapula. So here, this is the coracoid process. I have zoomed this out too much, and its action is depression and protraction of the scapula. If the insertion is fixed, it elevates third, fourth, and the fifth ribs. It rotates the scapula downward with rhomboids. So next muscle is the subclavius muscle. It originates from the upper surface of the first costal cartilage and inserted into the middle third of the inferior surface of the clavicle. In the picture you can clearly see this. This is the muscle basically, and it depresses the clavicle. It steadies the clavicle during movement of the shoulder girdle. Next muscle is the large muscle. It is trapezius. It arises from the medial third of the superior nuchal line of the occipital bone, external occipital protuberance, ligamentum nuchae, spine of the seventh cervical vertebra, spine and the supraspinous ligaments of all the thoracic vertebra, and it's inserted into the upper fibers into the posterior aspect of the lateral third of the clavicle, middle fibers into the medial border of the acromion process of the scapula, lower fibers into the spine of the scapula. In the picture, this is the actual diagram where it arises from the external occipital protuberance, ligamentum nuchae, spinal process of the C7, and inserted into the lateral third of the clavicle, middle fibers into the acromion process, and lower fibers into the spine of the scapula. So focused view of the insertion of this muscle. This is at the back of the person. Next muscle is the trapezius. Trapezius, it has got two types of nerve supply from the spinal part of accessory nerve. It's the motor fibers, and it also receives the proprioceptive sensory fibers from the third and the fourth cervical nerves. And its action is accompanied by the three different categories of the fibers. Upper fibers elevate the scapula, middle fibers they retract the scapula, and the lower fibers depress the scapula. With Sidatus Interior rotates the scapula upward for the abduction of the arm more than 90 degree. When the scapula is fixed, both sides muscle extend the head. In the diagram, you can clearly see this muscle. Next muscle is the latissimus dorsi muscle. It's also the muscle of the back, and it originates from the spines of the lower six thoracic vertebra, lower three or four ribs, lumbar fascia, and the posterior part of the iliac crest, and also from the inferior angle of the scapula. So in the picture, you can clearly see this. Basically, this is the muscle, and it's inserted into the floor of the bicipital groove of the humerus. You can see this. Here it is inserted into the bicipital groove of the humerus. It's supplied by the thoracodorsal nerve, and it helps in the adduction, extension, and the medial rotation of the arm, and it also helps in climbing. So the next muscle is the levator scapula. It originates from the transverse process of the upper four cervical vertebra and inserted into the dorsal lip of the medial border of the scapula above the level of spine. So here is its picture. In the zoomed out view, you can clearly see its origin, and it's inserted into the dorsal lip of the medial border of the scapula above the level of its spine. In the zoom of view, you can see this. So its nerve supply from the ventral rami of the third and the fourth cervical nerves, and from the dorsal scapular nerve. And its action is elevation of the scapula, and if the scapula is fixed, it bends the head to the same side. Now we have two muscles, rhomboid minor, rhomboid major. First of all, rhomboid minor, it rises from the lower part of the ligamentum nuchae, spine of the seventh cervical vertebra, and spine of the first thoracic vertebra, and inserted into the dorsal lip of the medial border of the scapula, opposite to root of its spine. In the picture, this is the muscle. You can clearly see this. First, above is rhomboid minor, below is the rhomboid major. And dorsal scapular nerve supplies this muscle. Its function is elevation of scapula with rhomboid major, and pect minor, it rotates the scapula downward. Then we have the rhomboid major muscle. It rises from the second to fifth spine of the thoracic vertebra and their supraspinous ligaments. In the close-up view, you can see this muscle. And inserted into the dorsal lip of the medial border of the scapula below the level of its spine. It's also supplied by the dorsal scapular nerve, and its muscle is almost same, that is elevation of scapula with rhomboid major and pect minor. It rotates the scapula downward. So now we will discuss muscles of the scapular region one by one. So in the brief view, they are deltoid, supraspinatus, infraspinatus, teres, minor, major, subscapularis, and the sidatus interior. So the first muscle is deltoid muscle. It's the most prominent muscle almost in the shoulder. It has got origin from the lateral third of the anterior border of the clavicle, middle fibers from the lateral border of the acromion process of the scapula, posterior fibers from the lower border of the spine of the scapula. You can see clearly in the picture, this is the muscle basically, most prominent muscle. And it's inserted into the deltoid tuberosity on the middle of the lateral surface of the shaft of the humerus. So just I am focusing and I am zooming out the insertion into the deltoid tuberosity. It's supplied from the axillary nerve as in the previous lecture with the formula that so anterior fibers flexes and medially rotates the arm, posterior fibers extends and laterally rotate the arm, middle fibers abducts the arm till the level of the head from 15 degree to the 90 degree. So in the cross sectional view, now we have two muscles, supraspinatus and the infraspinatus muscle. So first of all, supraspinatus, it rises from the supraspinous fossa of the scapula and inserted into the upper facet of the greater tuberosity of the humerus and the upper part of the capsule. So here it's above the spine. Above the spine there is fossa, which is supraspinous fossa. Below there is infraspinous fossa, and this is in the zoom up view. of this muscle, and it's supplied by the suprascapular nerve, and its action is start abduction of the arm from 0 to 15 degree and stabilizes and supports the shoulder joint rotator cuff muscle basically. Whereas there are four muscles we will discuss later on in this video. Other muscle is infraspinatus. It rises from the infraspinous process of the scapula and inserted into the middle facet impression of the greater tuberosity of the humerus and posterior part of the capsule of the shoulder, supplied by the suprascapular nerve, and it laterally rotates the arm and stabilizes and supports the shoulder joint. Basically, it's a part of rotator cuff muscle. So, in the close-up view, you are clearly seeing infraspinatus muscle inserted into the middle facet of the greater tubercle. So, now next muscle is teres minor muscle. It originates from the upper two-thirds of the dorsal lip of the lateral border of the scapula and inserted into the lower facet of the greater tuberosity, supplied by the axillary nerve, as I already mentioned by the formula that, and laterally rotates the arm and stabilizes and supports the shoulder joint. In the close-up view, you can see this is the muscle inserted into the inferior facet of the greater tubercle. Other is the teres major muscle. It rises from the lower third of the posterior surface of the lateral border of the scapula, inserted into the bicipital groove of the humerus, supplied by lower scapular subscapular nerve. It adducts, extends, and medially rotates the arm. In the close-up view, this is the teres major muscle. So you can clearly see the origin and the insertion of the muscle. This is the close-up view. So the next muscle is the Subscapularis muscle. It originates from the medial two-thirds of the subscapularis fossa of the interior surface of the scapula and from the inner surface of the subscapular fascia, and inserted into the lesser tuberosity of the humerus, supplied by upper and the lower subscapular nerve. It adducts and medially rotates the arm. In the close-up view, you can see its diagram. Basically, it's on the anterior surface of the scapula, one fossa which is subscapularis fossa, and above that this is a muscle. So inserted into the lesser tuberosity. Again, one more view. So last muscle in this series, it's the Sidatus Interior muscle. Originates by the 8 digitations from the outer surface of the upper 8 ribs, inserted into the anterior surface of the medial border of the scapula, mainly near the inferior angle, supplied by the long thoracic nerve. One clinical thing you must remember that its paralysis causes winging of scapula. It protracts the scapula anteriorly and fixes it to the thoracic wall. With the trapezius, it rotates the scapula upward. It acts as a strong accessory muscle of the inspiration also. So in the close-up view, you can clearly seeing the Sidatus Interior muscle originating from the 8 digitations and inserted into the anterior surface of the medial border of the scapula. In the close-up view, you are seeing this muscle and medial border of scapula, it's inserted. So this is the simplified diagram, and supplied by the long thoracic nerve. In the black it is shown there. If long thoracic nerve is paralyzed, it causes the paralysis of Sidatus Interior, and winging of scapula, a clinical condition, it occurs. So last I was saying rotator cuff muscles. Basically they form the cuff around the shoulder joint. There are 4 muscles you can memorize with the help of mnemonic sits. They are supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. They surround the shoulder joint except from the inferior aspect, which is the weak point. The adone helps in holding the head of the humerus in the glenoid cavity. They maintain the stability of the shoulder joint. If they are damaged, shoulder joint becomes unstable and it can dislocate easily from its cavity. So in the close-up view, you can clearly see it makes the cuff around the shoulder joint, around the glenoid cavity. It's the rotator cuff muscles. Now we come to the anterior compartment of the arm muscles. Basically, basically it is divided into two components. One is anterior component, other is the posterior component. In the anterior component, I made a mnemonic BBC. First B is for the bicep brachii, other is the brachialis, and third C is for the coracobrachialis. And in the posterior component, only one muscle is there, which is triceps. It has got lateral head, medial head, and the long head. So one by one we discuss. First of all, bicep brachii. It has got long head, short head. Long head rises from the supraspinatus tubercle of the scapula. Short head from the tip of the coracoid process of the scapula, and inserted into the posterior part of the radial tuberosity of the radius from the bicipital aponeurosis, in which it is inserted into the deep fascia of the upper part of medial side of the arm. You don't need to remember the nerve supply of forearm muscles. All of them are supplied by the only one nerve, which is the musculocutaneous nerve. It causes supination of the forearm and flexion of the forearm, weak flexion of the shoulder joint also. So in the close-up view, you can see clearly this is the muscle. One head is short head, other head is long head. Other is coracobrachialis, arises from the tip of coracoid process of the scapula with short head of the biceps and inserted in the middle third of the medial side of the shaft of the humerus, supplied by the musculocutaneous nerve, and it helps in the flexion of the shoulder joint and weak adduction of the shoulder joint also. Again, you don't need to accurately remember the action. All of them are flexors. So here is its close-up view. You can see easily in the zoom up view. Then we have got the brachialis muscle, originated from the lower half of the anterior surface of shaft of humerus and adjoining parts of the medial and the lateral intermuscular septa, inserted into the anterior surface of the coronoid process of the ulna and supplied by the musculocutaneous nerve. Only small part is supplied by the radial nerve, but you don't need to remember this. It causes the strong flexion of the elbow joint. So in the close-up view, you can see this easily. This is the brachioradialis muscle. So we have covered the anterior compartment. And now we will discuss posterior compartment of the arm. In the posterior compartment of the arm, you don't need to memorize the complicated things, because only one muscle is there, which is the tricep. Even a common person knows. It has got three heads: a long head, lateral head, and the medial head. Long head arises from the infraspinatus tubercle of the scapula. Lateral head arises from the upper half of the posterior surface of the shaft of the humerus, above and lateral to the spiral groove of the humerus. Medial head arises from the lower half of the posterior surface of the shaft of the humerus, below and medial to the spiral groove, and inserted into the upper surface of the olecranon process of the ulna. Again, because it's the posterior compartment, it's supplied by the radial nerve, and on the posterior compartment there are extensors, so it extends the forearm at the elbow joint. So in the close-up view, one head is medial head, one is lateral head, one is long head. In the close-up view, you can easily see this muscle, its origin and its insertion. Now we come to the forearm. Again, we divide the forearm into the anterior compartment, then the posterior compartment. Further, we divide the anterior compartment into superficial layer and the deep layer. There are 5 superficial layer muscles and the 3 are deep layer muscles. So you can memorize with the help of the mnemonic, which is FFFPP. Accordingly, Pronator, Teres, FCR, Palmaris longus, Flexor digitorum superficialis, and the FCU. In the deep layer, there are only 3 muscles: Flexor pollicis longus, Flexor digitorum profundus. As the name indicates, profundus is for the deep, and Pronator quadratus, because it's a square shape deep muscle. So first muscle here is Pronator teres muscle. It's originated from the medial epicondyle of the humerus And ulnar head, it rises from the medial border of the coronoid process of the ulna and inserted into the pronator tuberosity on the lateral surface of the middle part of the shaft of the radius supplied by the median nerve, and it causes pronation of the forearm at the radioulnar joint, flexion of the forearm at the elbow joint. So in the close-up view, you can see this is the muscle.